My name is Oscar Manrique. I'm a board-certified plastic surgeon. I'm originally from Bogota, Colombia in South America. I was born and raised there. I always wanted to be from the military. My dad, as a former officer and serving more than 40 years in the Colombian Air Force, was always what I wanted to be. At some point, my goal was to be a military doctor full-time, and I wanted to kind of see what was a surgical lifestyle. I remember once I was still not technically allowed to go into the operating rooms, and I found one of my senior medical students at that time, and I said, "Hey, listen, do you mind if I can go into the operating room?" And he's like, "Yeah, just put a mask and a hat. No one's gonna tell who you are." And so that's what I did, and by coincidence, that surgery, which I would never forget, was on Christmas Day, was a soldier that had a big trauma and wound to its face. And they were doing what's called a free tissue transfer or free flap. And since then I got fascinated about how could they do that? How was that possible? And so I was like, I want to do that someday in my life. At the end, that surgeon who was performing the surgery turned around and is like, "Who are you?" And I kind of identified myself, and I said I was a first-year medical student, that I was impressed for what he did. And from there on, they offered me a spot in plastic surgery at my hospital, which is the most prestigious plastic surgery program in our country. So I felt proud of all my work and all the effort that I put in. While I was with the plastic surgery group back in Colombia, surgeons from the US went to do this missionary work. And through one of my attendings, I remember asking, "Hey, can I scrub in one of these big cases?" They were kind of making a little bit fun of me because we didn't have internet or anything like that. And so they asked me, "Hey, do you know what the Mayo Clinic is?" And true story, I said, "No, I do not know what the Mayo Clinic is." He was the former chair of plastic surgery at Mayo Clinic. His name is John Woods. And so I got to scrub with him. I was fascinated. And at the end of the surgery, I said, "Hey, listen, Dr. Woods, what are the possibilities for me to go to the US and do plastic surgery?" And I don't think he was discouraging me, but he said, "Oscar, it's almost impossible. I mean, you're a foreign medical grad, you speak Spanish." That was it, but it kind of, he put me like the challenge of like, I want to show him that someday I can. And so by coincidence, my first job as an attending was at the Mayo Clinic. And so the true story was that when I got there as a first year attending, I still remember his words of saying how difficult it was, which, yeah, in reality is very difficult. And so I reached out to him and I said, "Hey, Dr. Woods, do you remember that medical student that you spoke, I guess was probably 15 years ago? I want to tell you that that you encouraged me to be a better person. Now I'm here and I'm at the Mayo Clinic where you were as a chief 15 years later." And so he emailed me back, "Dr. Manrique, I can't believe you did it. I mean, I'm like at the end of my career, I'm retired, but I can't believe you did it." And I was like, here I am. You don't imagine how much you can change someone's life, especially, I believe, for someone who's committed, who works hard, who is passionate about what they do. So for me, hearing those words when I was a first-year medical student, I think he was being very honest of how difficult. Through the ACGME, I think a foreign medical grad in plastics is only 0.3% of the population. So he was very grateful, and then I went to see him. Unfortunately, he passed away a couple of years ago, but for me, it was amazing kind of closing that circle. When I got here to the US at the end of the 1990s, I barely spoke English. I mean, like a couple of words, and it's not only that, but also not speaking like street English, but medical English, which is a little bit different. My first kind of experience coming here to the US as a medical student, I was offered the opportunity to rotate at a hospital in Boston. It was working for probably one of the most prestigious universities in the US. And so for me, it was, even though it was challenging, I think that people saw that I was very committed and that I was truly passionate for medicine, for taking great care of my patients. And so at the end of that 2-month rotation, they offered me to join them formally as a research fellow. I started my journey through there. I was doing mostly basic science, but I still had inside of me like that little seed of surgery. And so I reached out to a couple of Latin American surgeons that had my same pathway, but they're already there. They gave me the option to in my time off in the afternoon. So I was working 7 to 5 in the lab, and then in the afternoons I went to the Mass General Hospital to do research, now clinical and surgery. And that's why at the end I was like, this is what I was missing. And that's what I did for like another year or so. I started my training as a general surgeon in Boston, where I graduated as a general surgeon, and later on I applied for plastics, which I did in New York at the Montefiore Medical Hospital. I believe, and that's in my humble opinion, the difference between someone who has made it versus someone who's not is not because you're smarter or you're better, but I would say the main difference is that I was potentially more consistent. I never gave up, even if they told me you cannot make it, you cannot, I would like, okay, let's give it a shot, and I won't give up. Your job as a leader is not to criticize others or to always impose your point of view, but listen to other people first. And as we move along, I think there's definitely a lot of things that we learn. Every day you learn something from someone, even the most novice person up to the most experienced. There's something to learn from all of these ranges. The beauty of a plastic surgeon is that we definitely improve the quality of life of many patients that are around us. We're in that environment where you always have to look sharp, you have to be your best. You don't imagine sometimes how a small procedure or even a large procedure in aesthetic surgery can improve that quality of life of the patient, that would make them better in society, feel more comfortable with their own bodies when they go into a social event or in their daily lives. As I always tell my patients, the only thing that I can guarantee you 100% is that I will take great care of you. From the moment we meet you until you're done with your surgery, your post-op care. It's not just cutting and sewing, but going beyond that, understanding what's going on. First of all, I'm very honored to join Austin-Weston. Everyone that I have worked with are extremely friendly, have always been up to see what I'm doing, how can they help me, which you don't see that often. We have great experienced surgeons, from the founders up to the current plastic surgeons that we have. From my particular background as a Latino, the population here in the US has grown significantly. For example, the state of Virginia is the 7th highest in terms of the Latino population. They live around this area or even outside of Virginia and other states. Sometimes don't have that luxury of having a plastic surgeon that speaks their own language, that can look them in the eye and explain them, hey, listen, in my own words, what does that mean? So I think that that's a huge plus that I don't think that we see here. So I always tell, if my patient's happy, I'm very happy, because that's my goal, to make sure that at the end I provided the best I could as a surgeon, as a human being. Thank you so much for this kind interview. I appreciate the opportunity to talk a little bit about myself so that people can know my background. And I would encourage you all to follow us on social media so you can see the great work we do as a team here at Austin-Weston, for my patients and my other colleagues. Thank you.